It's true that with the current experience with CAR T cells, we don't have experience beyond 5 to 7 years, and so there's some things that we maybe don't know yet, and there are the potential for side effects 15, 20 years down the road that we haven't discovered yet, just as there are with any new therapies. So what we counsel patients on now is that because this is still a relatively new therapy, it's something that we continue to need to follow them far out, beyond 5 years, beyond 10 years, beyond 15 years, to see if there are new side effects that we may anticipate to develop. Right now, the main potential long-term side effect that we're seeing is really related to the actual efficacy of the CAR T cells, and that's B-cell aplasia. So this varies between different trials, but in general, there have been relapses seen in the 30 to 50% range. We have patients who initially achieve remission, and there are two types of relapses that have been seen. One is that if the CAR T cells do not persist for a long time, there may be residual leukemia that is able to relapse. And the other type of relapse is that the leukemia may change the way it appears so that it is no longer detected by the CAR T cells, and that's called CD19 loss or CD19 escape. And that has been the more common type of relapse that's been seen. When we are initially seeing a patient who's considering this therapy and we're evaluating them as a candidate, we do a lot of education from the physician side, from the nursing side, to talk about what it means in the immediate period, and then also what the follow-up will look like and what it will look like long term. And so there's a lot of one-on-one education, but there are also some educational materials that have been produced as these therapies have become more widely available.